Can you get rhinoplasty and a lip lift at the same time? This is an interesting thing. This is mildly controversial. So many surgeons will do them at the same time. As a general rule, I do not. Very carefully tell you the reason why. Rhinoplasty involves some combination of incisions at the base of the nose. A lip lift, a sub-nasal lip lift, involves an incision here. If I'm doing much anterior septal work and I dissect a lot of those tissues away, I'm compromising the blood supply to this area. If I further put an incision here, I further compromise it. And I have seen, at this point in my career, not patients of mine, 4 patients in my career who have had simultaneous rhinoplasties and lip lifts, and they've gotten necrosis of the skin right here. It's a devastating complication, and I don't do them at the same time. I tell patients, if we're gonna do a rhinoplasty and a lip lift, I wanna do the rhinoplasty first in most of my patients, and then the lip lift probably 2 to 3 months later when the blood supply to this part of the nose is reestablished. There are many people that will say to me, I've done rhinoplasty and lip lift safely, no problem. My argument with that is if you're doing a lot of anterior work on the nose and you're doing a nose properly, you're compromising the blood supply a little bit, and this extra incision from the lip lift can further compromise it. So I don't like to put the patient at risk. And I believe we're doing cosmetic surgery. Safety should be first. I don't want to do anything, even if the percentages are low. So can a rhinoplasty itself lift my lips? It doesn't really lift your lip. It can expose your lip more. So a person with a long nose, it may hood their lip, and having the tip of the nose lifted may change the orientation of the nose to the lip. So it may seem like it changes your lip, but in reality, it doesn't do anything to the vermilion of the lip. Does rhinoplasty change your lips? Probably a little bit. Certainly, without question, I tell all of my patients this. For a month after your rhinoplasty, your smile will seem odd because your lip, in all of us, has a certain excursion over our teeth. So when we smile, we show a certain amount of our teeth. In my case, I'm showing about 2/3 of the crown of my teeth. Does rhinoplasty affect your smile? Some people, when they smile, their lip goes up and shows half of their gum. We call that a gummy smile. What goes on is after your rhinoplasty, for about 3 to 4 weeks, the lip will not move quite as much as it moves normally, but it will come back entirely. You'll get 100% of your smile back. But I tell people, especially when I do a young woman with a really pretty smile, which a lot of my clientele are very attractive women who have beautiful smiles, their smile they don't quite show as much tooth, and they know that looks a little funny to them. It looks a little bit different and it feels different to them because their lip doesn't move as much. I tell them that it will affect your smile for about a month and then it will go entirely back to normal. If you have a question about your nose or your lips, I love doing rhinoplasties, have done many thousands of them, and I love doing lip lifts. It's a common procedure for me. Schedule a consultation for me to look at your nose and/or your lips. I'd love to talk to you about that. I'd love to answer questions for you. Schedule a consultation either virtually or in person with me. I look forward to seeing you soon. Thanks.